We'll start with Section 1, Paracetamol dosing and shortcuts. Then Section 2, Mefenamic Acid safety rules. Moving on to Section 3, Ibuprofen daily limits. And finally, Section 4, Diclofenac and Naproxen essentials.
Okay, Section 1, Paracetamol dosing and shortcuts. We are starting right off with the undisputed, totally versatile foundation of pediatric fever management.
So, the standard oral dose for paracetamol is 15 milligrams per kilogram per dose, and you can give that every 4 to 6 hours. But, and this is a big one, if you're administering it intravenously, that dose actually drops down to 10 milligrams per kilogram. It's absolutely vital to keep that oral versus IV distinction super clear in your head. And just for some real-world context, you're going to commonly see this prescribed under familiar brand names like Crocin or Calpol.
Now, what's really interesting here is a brilliant little mathematical shortcut from the source notes. To calculate the milliliter volume for standard pediatric syrups, just multiply the child's weight in kilograms by 0.3. Honestly, that's it. Weight times 0.3 gives you your ml volume almost instantly. It completely bypasses all those mental gymnastics of cross-multiplying formulation concentrations when you're under pressure. A real game changer.
Now, that being said, formulation matters tremendously here. For tiny patients weighing less than 10 kilograms, you absolutely must use the drops formulation, which is highly concentrated at 100 milligrams per 1 milliliter. For older or heavier kids over 10 kilos, you step up to standard syrups, and those usually come in 120 or 240 milligrams per 5 milliliters. Mixing these two up is a classic medication error. It happens, but keep this distinction firmly locked in your mind so it doesn't happen to you.
Moving right along, Section 2, Mefenamic Acid safety rules. As we transition to this second-line alternative, our clinical tone really needs to shift to be a bit more cautious.
For mefenamic acid, the specific dose you'd use to bring down a fever is 5 to 8 milligrams per kilogram per dose. You'll frequently see this one branded as MFTALP, commonly formulated at 100 milligrams per 5 milliliters. But listen, here is the very first rule the source material demands you follow. You absolutely must instruct that it be given with food to avoid severe gastric irritation. Don't skip that step. Now, before we reveal the answers in a second, I want to engage your clinical problem-solving mindset. Based on what you might already know or what you'd maybe suspect for NSAID-type medications, when should you immediately stop or entirely avoid using mefenamic acid in a pediatric patient? Like, what are the absolute red flags here?
So, the crucial point is, well, here are the non-negotiable constraints, straight from the source material. First up, do not use mefenamic acid for more than 7 days. Just don't do it. Second, it must be completely avoided in children with a history of seizures. And third, you must stop administration immediately if there are any complaints of diarrhea or skin rash. Look, these aren't just polite suggestions, right? They are strict, hard rules to ensure absolutely no harm is done.
All right, Section 3, Ibuprofen daily limits. Ibuprofen is an incredibly reliable workhorse in pediatric pain and fever management, but it comes with a strict daily ceiling that we absolutely need to respect.
The standard dosing window for ibuprofen is 5 to 10 milligrams per kilogram per dose, and that's administered every 6 to 8 hours. In the source notes we're looking at, this is specifically highlighted alongside the brand Ibugestic Plus, which is formulated at 100 milligrams per 5 milliliters. It's a highly effective drug, for sure when it's dosed carefully within these exact parameters.
And this brilliantly illustrates a really crucial comparison between our two most common medications. Paracetamol has a maximum limit of 60 milligrams per kilogram per day, but in strict contrast, ibuprofen has a hard maximum limit of 40 milligrams per kilogram in a 24-hour period. You really cannot safely utilize these medications without keeping these absolute daily maximums firmly locked into your memory. It's vital.
Finally, Section 4, Diclofenac and Naproxen essentials. We're now transitioning away from those common everyday staples and moving into the territory of heavier, more specialized pain relievers.
Now, here is where the calculations can get incredibly tricky. For Diclofenac, which you'll often see as injection Dynapar, the dose is 1 to 3 milligrams per kilogram per day, given every 8 hourly. But wait, for Naproxen, the dose is 5 to 7 milligrams per kilogram per dose, given every 8 to 12 hourly. Did you catch that vital difference there? One is a total daily allowance, the other is calculated per individual dose. Mixing up that single word literally changes the entire math equation, so be careful.
So, what does this all mean? We've successfully decoded this raw clinical data and built a really highly structured mental toolkit. Which medication profile do you feel most confident calculating for your next pediatric patient?
Think about it. Whether it's that awesome 0.3 math shortcut for paracetamol or the strict daily max of ibuprofen, you now have the visual map to make rapid, safe decisions. So the next time a fever spikes, remember, precision isn't just about the math, it's all about patient safety.